So you're in perimenopause and your knees are killing you. You are losing joint mobility. Think mobility as movement, but mobility also means your joints mechanics within. And right now, my knee is in flexion, and my knee joint here has to gap to open. So this is a lot of flexion in my knee, but I have fought this past year to get this flexion. And I have worked on doing mat exercises to get me to the floor so I can do this amount of flexion. And let me show you how. So I used yoga mats. I prefer to use a thicker yoga mat once my knees started hurting when kneeling compared to my decorative cute one. And I got these balls, but you could use possibly tennis balls in a sock, but I was putting this behind my knee, and let me show you. So I'm gonna put this ball in the nook of my knee, and then, you see I'm like on my hands and knees, I'm going to sit back onto that ball, and it's going to mobilize this joint. So right now I feel tightness right here from sitting back on that ball, and I'm not fully kneeling, but I am gapping this joint to mobilize it. Now, if this is too hard to get on your knees, sit and put the ball under your knee, and then flex, and then try to bring the knee closer towards you. You would repeat this several times. So this is one way I mobilize my own knee. Another thing that I did was practice kneeling. Once again, a thick yoga mat, and put a pillow under my booty between my hips. So I put the pillow here, and then kneel. Coming up, kneel. Coming up, kneel. Coming up, right? As you get better, you can come further down. I also work to bring my heels up, and I move different motions. But I worked on this daily for a year. I would practice getting to the floor and kneeling. Then, so just rocking back onto my heels, coming forward. Then when I would go to get up, I would try to focus to swing my leg forward like this and not do this whole kind of come up the side weird. I worked to get the mobility to even do this. Now, if that's too hard, then you pull your chair in, you do your kneeling, you're gonna get your stability. I'm gonna kind of put it right at my side. And you push forward. Now, I am in this position, this 90-90 position. I am going to lean forward with my trunk and drive my weight down through this particular shin, because I am going to teach my quad how to push me up from this position. Now, I need this front leg and back leg working, but oftentimes you guys are not using the front leg because it hurts, or oftentimes it's really weak. If it's too far forward, pull it back in. You can put your hand on your hip. You can have another chair here, and then you're gonna push up and then back down. It is, in essence, a split squat in exercise. And this is why I practice getting to the ground, because I noticed my kids were older, I wasn't getting to the ground anymore, and then it became difficult. So I started talking to my patients about how difficult it was to get to the floor, and all of them said the same thing. And I'm like, guys, if we don't use it, we're going to lose it. And as you get older, the two things that really hurt you as a female is cardiovascular disease and sarcopenia and osteoporosis, and you become frail, and then you fall and you can't get back up. I don't want that to happen to you. I want you to be able to get to the floor and get back up. So we're gonna practice it by mobilizing your joint and getting strength. Now, this is also why I like whole body vibration, because when I am doing a mini squat on the whole body vibration plate, that mini squat is making my quads fire. I am putting strain on my knee. It is mobilizing my joint, but it's helpful for this cause. It is also helpful for my bone density. So all the things that I'm doing, there's a method to my madness, because I want to be fabulous at 86 and I don't want to be a broken jalopy.